Welcome to the second in a three-part series on the 10 things you need to know about running injuries. I'm John Wolf, the presenter, and I will be continuing the discussion on the things that you need to know about running injuries from our first presentation. The third thing you need to know about running injuries is about the ground. And we know that the ground is hard in most cases. One of the options that you have to minimize the opportunity for injuries or even begin to run as you recover from an injury is begin to manage the ground that you run on. So if the ground that you typically run on is hard, make it softer. So the question many people have is which way to go. I would recommend that you choose the dirt track or a track that's used for training, such as an asphalt track up at a local high school or college where you can get some access to a surface that's going to be a little bit more forgiving on your joints. Also, trail running, for those of you who are interested, requires a certain amount of skill. So if you do or are a trail runner, make sure that you stay fresh, because many people end up having injuries simply because they slip on a rock or they trip. And you want your muscles and your nervous system to be sharp in order to minimize the opportunity for an injury. The fourth thing you need to know is that running is a shocking experience and that you better attenuate it. Attenuation is a good word for absorption. So in other words, what we're going to talk about now is shock absorption. In order to distribute shock, your body has a pretty sophisticated mechanism by which it's able to take the ground reaction force and distribute it throughout your system. We call this a triplanar mechanism because the lower extremities are developed and operate in a very specific way in order to use the muscles as the primary shock absorbers or primary shock attenuators. The bones and the joints have some capacity to attenuate, but what we're looking for to minimize injury to joint surfaces and tendons and ligaments is your muscles' ability to absorb those forces. However, what we know is that fatigue creates stiffness in the muscles. So the muscles, when they become fatigued, have less of an ability to absorb shock, and that subsequently means that it's going to deliver forces to the joint surfaces and to the tendons. Pain, if you have pain, also creates inhibition of the muscles, which alters the muscle mechanics, again making it less able to absorb shock as you hit the ground during running. Because we know that the body will try to compensate in order to protect itself. So you want to be aware of fatigue, and if you do become fatigued, that's often when injuries happen. We are big fans of proactive physical therapy and in putting in place some sort of resistance training program in order to improve core stability and improve multiplanar strengthening. Also, making sure that you have good eccentric-concentric coupling. Now, this is a bit of a fancy word that many of you may understand as a plyometric. And here's a pretty good video that kind of describes what I mean by that. You'll see that this runner has the ability to absorb shock pretty darn well on his right leg, but on his left leg, he hits very hard. In other words, he doesn't absorb the force through this left leg. And the consequences of that are that he's going to develop some pain in his tendon, at the patellar tendon, or possibly even up in his hip or in his low back. There are very specific exercises that we prescribe in order to mitigate the results of fatigue and to train the body so that it can be a better shock absorbing mechanism. Some of the exercises include things that we do with the feet, things that we do with the hip, and things that we do with the core to make sure that the muscles of the hip and the rest of the leg are appropriately strengthened to maximize shock absorption. Another important way that you can maximize your ability to attenuate the shock of running is a good shoe choice. Now, shoes have a purpose, and I know that it's very popular now to have minimalized or minimalist shoes or even going shoeless, but shoes do play a role in absorbing the forces from gravity and ground reaction forces. And there are many ways and many shoes that you can choose, and to some extent we're fans. Another way to minimize shock is appropriate shoe choice. Now, I have to say right off that not everyone is a good candidate for minimalist shoes or shoes that don't have much of a sole. I am still a pretty big fan of most of us using some kind of a shoe that allows some shock absorption. It also has a certain amount of stiffness to match the certain demands of your body, and shoes that fit your body mechanics, your body weight, and your running style. Absolutely, you should be investing in the right shoe for you. The fifth thing that you need to know about running injuries is to get off the brakes. It slows you down. When we talk about brakes, we're talking about the braking impulse, which is part of a normal part of the stride. When we talk about brakes, what we're talking about is that part of the gait cycle in running that is attributed to the braking impulse, or that part of the running cycle that slows you down when you hit the ground. More specifically, it's that point of contact when your front leg is out to hit the ground, and it's the distance that is between your center of gravity and the distance that your foot is in front of that center of gravity. What happens in this part of the running cycle is that the further this foot is out in front of you, the more likely that there's a ground reaction force that acts against the forward progress that you're making. So when we say get off the brakes, what we're saying is that one of the options for you to do is to decrease this distance between your front leg when you hit the ground and your center of gravity. The techniques that people are using to do this are to shorten your stride length. Another option is to run uphill or a gradual incline, such as on a treadmill. What you also want to do is be very mindful on the downhill, because the downhill has a tremendous high percentage of ground reaction forces because you have to slow yourself down against gravity. Another phrase that we use is keep it between your legs. It's an interesting concept because when we teach runners how to better absorb forces, we're using all of the muscles of the core, including the muscles of the pelvic floor. And if you are already fatigued, you want to be very cautious, because when you are fatigued, as I mentioned before, your muscles are going to be less likely to absorb forces efficiently. The sixth thing you need to know is about the joints, and to protect them or replace them and then protect them. The joints of your body are very, very sophisticated structures, and they've been designed specifically with protective coatings on the end of each bone that is called cartilage. And most of you are familiar with cartilage, and there's a couple of different kinds of cartilage. One cartilage is that which is at the end of your bones, and that's called articular cartilage. In the knee and in a few other joints of the body, there are structures called meniscus. And the meniscus is also a structure that is a cartilage and can be attributed to one of the pain generators in the knee if it's not appropriately diagnosed or treated. Now, I don't consider myself a runner. However, I do enjoy running, and up until not long ago, I was unable to run because of a tear in my knee, or in the meniscus of my knee, that required a surgical repair. And since that surgical repair and some extensive physical therapy, I was able to return to running with great success. So as I mentioned, cartilage is the key to success, and it serves as a protective covering on the ends of each of the bone. there's a subchondral bone, and then there's this articular cartilage that does a couple of things. Because it's inside the joint, it's almost frictionless. It's amazing because this cartilage forms a small water surface or fluid surface on the ends of this cartilage, which allows a near frictionless environment. However, this cartilage is also avascular, which means it doesn't have a vascular supply, which decreases its ability to get nutrition. And in fact, it has to get nutrition from the fluid circulation and from a diffusion process from this subchondral bone, which means that overall, cartilage has a poor, if any, regenerative capacity. So once you injure this cartilage, it is very, very difficult and many times, most of the time, impossible to regenerate it. For those who do have extensive cartilage damage, usually what happens is that there's a big adaptation to this subchondral bone. The subchondral bone will develop cysts and develop what most of us know as arthritis or arthrosis. Fortunately, modern medicine has created the ability to actually replace this joint surface with what would be an artificial joint. Unfortunately, however, these joints are not built for running, and yet. And I say that because modern technology is constantly looking for ways to improve the mechanical properties of these joints. What we do know is that physical therapy is essential after a knee replacement surgery for those who want to be active. Because if you don't have the shock capacity or the shock absorbing capacity of the muscle, then you're not going to be able to protect your artificial joint as well as you'd like to. And it's also going to require at some level a lower impact exercise. This is the conclusion of part 2 of a 3-part series of the 10 things you need to know about running injuries. Please join us for part 3.